Sharks? Yes, sharks. As skeptical as we were, we set out to see for ourselves if shark cartilage is indeed an effective treatment for the awful scourge of cancer. The premise behind Lane's approach is that most tumors cannot grow without a network of blood vessels to nourish them, and that shark cartilage works to inhibit blood vessel growth. Simply put, cut off the blood supply, and the tumor will slowly die. The procedure seems fairly simple. A blender and a big syringe. Shark cartilage powder is mixed with sterile water and given to the patients rectally, and later he brought along Dr. Charles Simone, a veteran oncologist who spent 5 years doing research at the National Cancer Institute in Bethesda to do a preliminary evaluation of the patients.
It's hard to get a comparison view, but the grossly dilated ventricles here, these big black areas, seem to be not there now.
Dr. Simone made a point of doing physical examinations of the patients, and he found that with most of them, the early results were promising. Then, 10 weeks later, 60 Minutes went back to Cuba with Bill Lane and Dr. Simone to see for ourselves what were the results. It was apparent that things had changed for this 83-year-old former boxer. He had prostate cancer and could hardly walk when he started on shark cartilage 16 weeks before. These were some of the patients who made the most improvement, but there were others for whom the shark cartilage was not effective. 6 died from their disease or complications. Some had tumors that became smaller and then began to grow again. But the majority of the patients said they felt better. Their pain had diminished or had gone away. Dr. Menendez and Dr. Simone considered the results significant and that further research with shark cartilage was definitely warranted. But at the final evaluation in Havana, everyone was concerned about cancer patients who might be watching this broadcast.
You can't put a green light out for millions of patients to do this. You need to work within the structured community. That's very important.
So you don't go to your nearest health food store and get shark cartilage?
I think if you do it on your own, you'll get in trouble. You should have it under the supervision of somebody who's at least open-minded about this. And knowing that they have failed chemotherapy, 2, 3, 4 different types of chemotherapy.
Or radiation.
Or anything else.
When the 16-week trial was over, Dr. Simone felt that out of the 29 patients, he could fairly evaluate only 15. For some, he said, were so close to death at the beginning they should not have been included. And on others, the data was insufficient. Out of the 15 he evaluated, 3, he said, clearly showed signs of progress. You saw the patients in person, right? You saw their x-rays. You saw their sonograms.
Yes.
The bottom line on shark cartilage, Dr. Simone?
At this point, early in the stage of the history of shark cartilage, I think we have to say that there are intriguing data enough to pursue in a more formal way. But just a note, in the last 50 years, we have not made any significant progress in the treatment of cancer in adults. So we need to look at other issues.
Charles Simone has submitted a protocol to the NIH Office of Alternative Medicine for a formal study of shark cartilage here in the United States.